Hi there, this is Just Nigeria coming up on the program. Accessing healthcare in the pandemic. We see how the battle against coronavirus is undermining the treatment of other life-threatening diseases in Nigeria. Also, coping with the new normal. We find out how dealing with coronavirus is impacting our mental health. And waste to food. See how two young women are championing the campaign for recycling in Nigeria. Plus,
my name is Chidere Fine. Check me out.
Meet the Nigerian chef promoting African cuisines in Brazil. Welcome to Just Nigeria from the BBC and Channels TV, where we analyze and dissect stories making the rounds on social media. I am Wali Fakile. Let's get on straight to our top story for today. With a rising number of cases of COVID-19 in Nigeria, containing the virus is a primary concern for health authorities. However, it appears that other illnesses with higher death rates than COVID-19 have been overlooked. In this story, Just Nigeria's Ajoke Olodse takes a look at how the fight against coronavirus is impacting public health.
The coronavirus pandemic continues to change the world as we know it. COVID-19 is pushing healthcare systems to breaking points and leaving countries with inadequate facilities grappling with more emergencies. The 2019 ranking of global healthcare systems by the World Health Organization rates Nigeria 187 of 190 countries. This could suggest most people have limited access to healthcare. With rising number of confirmed cases of the virus and countries slowly easing their lockdowns, Nigeria, like most countries, continues to grapple with new realities. Although containing the COVID-19 pandemic remains a priority, other health needs of Nigerians may have been left to suffer. Some people with pre-existing conditions have complained of neglect and limited access to health care. Nwachukwu Alagbu's wife, a mother of 4 children, was diagnosed with hypertension and rushed to the emergency unit of the University of Nigeria Teaching Hospital, Enugu. He claims the doctors on duty refused her treatment.
I now called the female doctor there. Please, can you help me attend to my wife? This is a mother of 4. And she's my wife. That is going down by the minute. Please, I know you are a mother, and you know what it means to lose a wife and a mother. Please attend to her. And the woman told me, if I were to be her brother, will I tell her to go and touch this woman and die? The doctor that sent us for tests kept on calling these people. And he gave the doctor on ground on emergency phone. The doctor was like harassing the man and was telling him that you are my fellow doctor, you're supposed not to be talking to me in this manner. The doctor was just telling you just do your job and save this woman. I know her. Her problem is just BP. Just give her a little aid. The woman will come back normal. And this doctor refused until my wife gave up inside the car.
We reached out to authorities at the University of Nigeria Teaching Hospital, Enugu, but they refused to comment. Just like Nwachukwu, Benjamin lost a sister who had been diagnosed with cancer and was receiving treatment at the Lagos University Teaching Hospital before government imposed a lockdown. He shares his experiences with me.
Unfortunately, during this lockdown period, access to health facility became so tedious. Immediately after the easing of the lockdown, they had to scheduling me. That was for Thursday. And on Thursday when they went, unfortunately for her, maybe the cancer have eaten so deep those period of no treatment. Around that period, few hours, or so unfortunately, she passed away.
Alagbu and Benjamin could be described as the victims of the failure of the Nigerian health system. They are concerned by what they describe as a denial of a person's basic rights to health care and, in worst cases, preventable deaths.
Even if it's COVID-19, can't they attend to her? Don't they have PPE and all these things? So if somebody is even COVID-19 patient, they will leave her to just die like that.
Every effort to reach them in loot proved abortive. There wasn't any immediate solution for us to come. So if, she had gotten that health care, as at when due, sincerely, the tendency is there. The tendency is there that she could survive.
Lanre Adeyemo is the Chairman Medical Advisory Committee at LUTH. He says the challenges of COVID-19 and recent restrictions may have forced the hospital to reorganize its activities, but insists LUTH's vital operations have been intact.
LUTH has a world-class cancer center, NHCC, and that center has now closed down for a day. Maybe because of the lockdown and some issues associated with it. Maybe the patient came late before we could gather this and that. Patient couldn't survive. But like I said, it's quite unfortunate. But I am aware that we hope.
With widespread fears of infection and hospitals limiting services to emergencies, thereby turning some patients away, the fate of many living with other forms of life-threatening diseases continues to hang in the balance.
Many of the clinics have been scaled down. Many of the interaction with patients has been reduced, and also many of the patients that would have been admitted have been carefully selected so that we do not have getting our bed space crowded.
Meanwhile, the Nigerian Medical Association insists lack of access to personal protective equipment and adequate insurance cover for its members on the front line could mean access to public health care may remain limited.
If we have health workers and doctors staying at their duty posts, it means they are ready to take care of patients coming into their facility. Unfortunately, if they don't have such protective equipment, I'm afraid it may be difficult for you to ask them to go and risk their life.
With health workers refusing to risk their lives, what alternatives do authorities have to bridge the gap?
We do understand that it's not only desirable, it is compulsory for us to make PPEs available to particularly the frontline workers in our various hospitals, and that is being addressed, and that much I can tell you because we continue to engage with the leadership of the NMA and of course other health workers in JUHESU and as a Joint Health Workers Union. We do engage them and try to address all these issues.
The need to restore confidence to an already wary team of health workers and address limitations to healthcare should become a priority for everyone. This could help prevent a bigger health crisis that could see the country lose more people compared to the COVID-19 death toll. Ajoke Hulotse, GIS Nigeria.